All right, good morning, everybody. Dr. Rafich here from Vet Triage. Sunday, July 28th, 8:38 a.m. Pacific time. And by the way, shout out to my old hospital, Long Island Veterinary Specialist. There it is. This is their cup that I borrowed forever from the hospital. And yeah, I did my surgery. I did 2 surgery internships there, and I did my surgical residency there, and I stayed there. Total almost 10 years practicing at that hospital. So phenomenal facility, thumbs up. So we're going to talk about marijuana exposure, marijuana toxicity in dogs. And the reason for that is because it's just very common. This is not intended to treat your dog or diagnose your dog, because it requires veterinary investigation to figure out if marijuana is actually the cause of what you're seeing with your pet, and what to do about it. Some cases are emergency, most are not, but you need to talk to a veterinarian. So vet triage is great for marijuana cases, because most of the time, even if you don't know it yet, and the vet investigates and you guys figure out, oh yeah, you know what, it could be exposure to marijuana. They're usually not an emergency, and you'll feel so much better after talking to the vet about it. So marijuana in dogs causes similar symptoms to people, to most of the time. They go through their high phase, then they end up getting really sleepy, and they'll sleep for a while, and then they'll be very hungry when they wake up, and that's usually the extent of it. So it kind of follows the same cycle as human beings who use it recreationally. The difference is with dogs, of course, they don't know what they're ingesting. They just see something that's like smelly or interesting or whatever, and they go for it. And whereas people, when you get those effects, you kind of expect them. You sort of know that it's going to do something to alter your mental state. But dogs don't know that, and so they look a lot more freaked out than people are. Maybe that's the paranoia stage. I don't know, but so yeah. So first they'll go through a phase of being high. Now that will happen pretty quickly after exposure. Usually within 20-30 minutes. You'll start seeing it. They'll be loopy and wobbly on their feet. They're whimpering, they're trembling, they're hiding. And a lot of dogs actually will show what looks like urinary incontinence while they're in this high phase where they're dribbling urine. It's pretty typical. I presume the cause of that is because the urethral sphincter is relaxed because of them being high. So they just can't hold their urine that well. But you don't see the same thing with feces, with bowel movements. The innervation to the urinary bladder is very specific, and whereas the innervation to the colon is very diffuse. So that may be a reason why you don't see bowel movement issues, but you do see urinary incontinence. Anyway, it's going to be temporary if it's from marijuana. And that being high phase can last minutes to hours. And then finally, if you let them hang out in a kind of a dim lit room or dark room with no noise, no excitement, they'll fall asleep, and they'll sleep for like 10, 12 hours, even longer. They're gone. Their body can't metabolize it to the extent that human beings can metabolize it, so it lasts longer in their body. And also, whereas human beings kind of can gauge what dose they want to take of this stuff, dogs don't have any awareness of that. They just eat whatever's there, and and that's what they're looking for. So let me see here. Okay, hold on. All right. So anyway, and then after they wake up, then usually they have a voracious appetite. They're pretty much back to normal, and they just are hungry. So that's how we handle that. That's the kind of progression of it. Now, the other thing that's unique to dogs that are exposed to marijuana is they are sensitive to light and sound. So anytime there's like a light, like bright light, or you clap your hands or something, they're very flinching and twitching and whatever, and they run under the table, run under the furniture, because they are they're hypersensitive to this stuff. So you want to make sure that, aside from letting them kind of write it out, that you keep lights to a minimum, sounds to a minimum, excitement to a minimum. And again, this is all under the direction of the veterinarian, who suspects that you are your dog was exposed to this stuff. Now, you can have much more severe symptoms, like, for example, seizures from marijuana. Typically, it's if they ingested a large amount, like so large that the chance of you having it at home for recreational use is almost zero. It needs to be like an insane, like a heavy duty drug dealer amount for that to happen. But because dogs and people can undergo what's called idiosyncratic reactions, which means that their body reacts to a toxicity or a product in an unusual way, or in a way that is like a toxicity, but in other animals at that dose it shouldn't be, then you have a dog who's just insanely sensitive to this stuff and having seizures. They only had a little bit of it. And so that's really important for the veterinarian to discuss with you, even though most cases are not going to have idiosyncratic reactions. Still, you want to make sure you're prepared for that possibility, because the vet can't predict, just from looking at your dog, which ones are prone to having an exaggerated response to marijuana and which ones will have the typical response. So that's also key there. So you seldom need to talk to a pet poison hotline or poison control for this type of thing. If you can talk to a veterinarian, especially on vet triage, and get their advice, you don't need to spend extra money and waste more time with poison control. You can have the veterinarian talk to you. That being said, if you do end up going to the vet hospital and they confirm marijuana, either because of the history and symptoms, or because you know your dog got into it, or they do like a drug test and find out that your dog got exposed to it, then they'll hospitalize your dog mainly for observation, but also they'll keep lights down, sounds low. They will put the dogs in IV fluids. The intravenous fluids will help with the cardiovascular elimination of the product. And then they'll do blood work to make sure there's no electrolyte abnormalities or blood sugar issues. They'll run their blood work and the x-rays to confirm there's no other conditions. It's possible you could have marijuana toxicity alone or alongside some other thing, and they just randomly happen at the same time. But in order for them to be thorough, otherwise it's a wait and see for the most part. And then, of course, they'll put your dog on a seizure watch. So they'll look for any seizures that may happen. Hey, audience member, thanks for joining. Feel free to ask any questions. They'll watch for any seizures, and if any seizures or other neurologic concerns occur, they will address it there. And so ideally, you want to be in a hospital that has 24-hour care, or at least overnight care. But honestly, if your dog hasn't shown severe symptoms throughout the day, and the vet closes at like 5 or 6 or whatever, then you can just go there, and for a few hours they'll say, okay, your dog hasn't shown any symptoms. Here are the emergency options if things progress. Otherwise, we don't anticipate any progression, and continue with this care. And that's it. That's how we handle marijuana exposure. As far as like CBD and THC products, the marijuana itself is not legalized everywhere yet in the States. And I think federally it's still a problem in terms of it being illegal, but it is becoming more and more widespread. And a lot of very helpful CBD products for dogs are out there. And a lot of people have used that stuff for treating random conditions like anxiety or seizures or whatever, and with good success. Now, whether or not that success is a placebo effect or whether it's actual response to therapy, I don't know. But I think these products have probably a permanent fixture in the veterinary field, and hopefully we can get more and more studies on them to see like what dosing, what product differences there are, what conditions can you treat for, how frequent, what's the duration of treatment with it, etc. These are well, anyway, the products that are out there are really good. My only advice, really, because I for veterinarians, it's a bit awkward because the legal implications of it, as well as lack of medical studies. I just tell folks simply just go to Google and search what CBD products people are using for arthritis and seizures and anxiety and whatever else, and see what people are raving about. And if you're finding a lot of positive comments about a product, then follow it and see what happens. At the end of the day, this stuff, if they're being truthful on the label for what's included in them, they shouldn't be dangerous. and I haven't seen any interactions with other drugs that your dog might be on. So I think it's fine to go ahead. Of course, you still want to do it with a veterinarian at least telling you that it's okay. But most people out there, I'm sure, are using CBD products without any veterinarian involvement, and so be it. Whatever it is, it is. So, all right. Well, that's pretty much it for today, guys. Thanks for everybody watching on the playback. Feel free to subscribe, hit like, do all the things. I'll see you guys tomorrow on Monday, July 29th, and we'll talk to you then. Take care. Bye.